what happened at the Kalanger Centenary Hospital actually sent shivers down the spine of many people. You know, Tamil Nadu is one state which has very good medical facilities. A lot of people travel, there is medical tourism as it was. But what happened yesterday is just blatant lawlessness. The person who stabbed the doctor obviously was under perhaps the preconceived notion that it's so easy to do it, right? I will enter with a bunch of people, rowdies, and I will stab the doctor. What's the big deal about it? No fear.
Yes, I think first of all, we should condemn any such attack. So it's absolutely inhuman and it's not right. And because medical fraternity is one thing which is like, we can't live without. We actually, when we go to them, we treat them as God and we want them to save lives, etc. So condemn the attack is definitely what we do. But beyond that, there are certain things which we need to look at. For example, we know the kind of crowd which comes to government hospitals. It's massive. It is the apathy of the state governments or any state government. We can't blame just DMK alone here. I think universally, the state governments do not, really concentrate on these hospitals or ensure they are adequately staffed and there is law and order, etc. Because none of the politicians use these public hospitals. It is only the poor who go there because most of the time, you take whether it's Jayalalitha or Karunanidhi, either they are in Kaveri or they are in Apollo. They don't go to their own hospital which are named after them. So that is what this is also Kalanger Centenary Hospital,
Yes.
and but never has any kind of
Yeah.
quality
Yeah.
with the private hospital.
Yeah.
So having said that,
Huh.
now we also have to understand all these doctors who normally work in government hospitals also have private clinics. Now that is against the law, but they do it because the money is
Yeah.
green. In fact, this doctor, he also works at Kaveri Hospital.
Right.
Now that's what we need to understand. Now, the complaint from the mother, the accused, whoever stabbed him, his mother is that this doctor was always disrespectful and he did not talk to them politely. He's always aggressive, and that's how he goes
Yeah.
about. So I find this is very practical, Sudha, for a simple reason because these doctors are overworked. They work here, they work
Yeah.
here in the government
Yeah,
hospitals, they do a
Murali,
private
I
service.
totally agree with you, whatever you're saying, because
Yeah,
it's the same situation in Delhi as well. But still, it doesn't
yes.
give anyone any reason to either slap
No,
someone
that's
or
that
to
we are
stab
definitely
someone. And
condemn.
I think it is deteriorating law
Yes,
and order. They do it
yes,
with brazenness,
yes.
with impunity. Venkat Narayan, sir, you know, for the past 6 months or so, and we've discussed this many times, Tamil Nadu seems to be falling into a rabbit hole of complete lawlessness. We saw how in broad daylight, much like cinema, you know, we saw Armstrong being hacked. There was very careful orchestration of this. Later, many others were hacked on the street. It's now become very, I'm sorry to use that word, fashionable to come and say, you know, I will hack you on the streets. We see it in films, but it's happening in real life. And then this also, the 25-year-old the man accused, alleged accused, enters with a knife and then stabs him 7 times. He must have done it. Yes, anger is one thing. No one behaves like this. It is, you know, absolutely that there is no one watching me, so I can get away with whatever, with murder, as they say.
Yeah, it's absolutely shocking, Sudha. But the fact remains that, you know, the government of Tamil Nadu has not, given jobs to 5,000 doctors. The sanctioned number is 18,000 doctors in Tamil Nadu, but 5,000 doctors have not been appointed so far. On an average, a doctor in Chennai sees 200 patients every day in a government hospital. At the most, ideally, you should be seeing not more than 30 patients. And in a country of 145 crores of people, we have only 10 lakh doctors and 20 lakh nurses. that is not good enough. The World Health Organization has recommended that there should be one doctor and three nurses per 1,000 people. But what is the state in our country? There are only 1.7 doctors per 1 doctor for 1,700 people and 1.7 nurses for 1,000 people. This is a very pathetic state of affairs. The bottom line is Indian
Yeah, but
hospitals, particularly government hospitals, are overcrowded and understaffed.
yeah.
Unless we do something about that, this wretched problem will
But
continue.
then
And
this problem, this story is also about a complete lack of law and order. You know, it's like there is no fear of God, there is no fear of law. Imagine me getting out of my car and, slapping one traffic policeman. How can you do that? Advocate Saravanan Annadurai, spokesperson for the DMK, is also joining us, but on the phone line. Saravanan, thank you for joining on the broadcast. Saravanan, amongst other things, which is a very sad case of Dr. Balaji being stabbed, and of course, who's now recovering, and I hope, this speedy recovery to him. The law and order situation in Tamil Nadu needs a kind of a relook. Is what it's not just the opposition. I'm not talking on behalf. I'm talking on behalf of general people. They feel with Udayanidhi Stalin, who's young blood, who's the deputy chief minister, you, your party and your government both need to really look at why the law and order situation where public hacking, public stabbing, public slapping, public abusing has gone up.
Yeah. If you're going to link this incident with the law and order situation, I think then I would say that you are wrong. Because law and order is entirely different. This is this is a personal incident. A person who is not happy or unhappy, rightly or wrongly, he felt so and he went inside the doctor's cabin where the treatment was given and he stabbed him. So which kind of law and order situation can prevent this kind of incident?
Really, with a knife? Saravanan, with a knife?
Yeah.
Entering a hospital with a knife? Can I enter?
No. That's what, Sudha. No hospitals just have metal detectors to frisk everybody entering.
What about police posts? Now Masubramanian has said police post. Where was the police?
Police were there. Every hospital, every government hospital has a police station in the state of Tamil Nadu. In the city, all the big hospitals, they have this thing. So let us not confuse law and order with all these things here. It's not the right thing. See, this is a one-off incident where we are looking at it.
Lovely, Saravanan, but even Stanley Medical College, you saw one man. Of course, I really don't want to sit on judgment. Apparently, he's mentally ill, and I think he needs treatment. But he also goes and slaps a doctor. I mean, Muralidharan, let me come to you. Listen, I am only talking about the fear of God. I gave you an example. When you slap, abuse, road rage cases, which happen all over India with luxury cars, they happen because they know what is there. I will hit someone, then my father will pay a huge bribe, I will get away, then maybe I'll put the blame on the driver. I am bringing up law and order because when there are poor people who are coming to government hospitals, we need to be doubly care. We don't need boutique hospitals in this country only. These government hospitals do great service. That is what this country is based on, Muralidharan. And when you say the police was there, then what was the police doing? Apparently this man, bolted the door, is what Dr. Senthil told me yesterday, and stabs you. There are eyewitnesses, ward boys, other patients who shouted, and said what is going on, and then they were the ones who took the doctor and said that, to the ICU. So don't you think that otherwise, why should Ma Subramanian said, oh, we'll put CCTV, we will put this, that and the other, Muralidharan? There is a lack of law and order, right? There is a casual, casualness.
I wanted to come to that little later because the law and order is a complete mess. I don't know, just 2 days back, there was a Supreme Court order. Now, what had happened, a small, poor laborer's kid was continuously raped by a gunda. The cops in Ananagar police station refused to take the case. Then when the baby was taken to, it's a small girl, she was taken to the hospital. The doctor said that she's so badly injured and you guys are not filed a complaint yet. Then after that, the complaint was filed, but nothing was happening. The High Court decided that there should be a CBI inquiry because of the huge cover-up which was happening. Now, the cops from Tamil Nadu, the police force, they went on appeal against this order that the High Court judges have ordered for a CBI inquiry. And again, Supreme Court pulled them up, saying that this cannot be accepted at any cost, and they have asked the state to bear all the expenses for the mother to appeal this case in the Supreme Court. And this is what is happening in Tamil Nadu. The Tamil Nadu has become not only a police state. This Tamil Nadu state is currently being run by IAS and IFS officers. It is not being run by Stalin or his son. That is a pathetic state, and many journalists have voiced about it, but unfortunately, the government is not paying any heed.
Saravanan, one of the best ways of kind of, relook, because you are a people's government, Saravanan, is to see that we'll take a look at it. Complete denial, really doesn't work. I think Saravanan has left this conversation, and predictably so. Venkat Narayan sir, I want to ask you, like what Muralidharan said, I'll give you the last question, sir. Don't you think that they need to relook at it? By denying it doesn't help, sir. I mean, I can make a list right now, and these are not NCRB data, because they will say, oh, NCRB data is all wrong, and they only take some cases, this, that, and the other. Every day you hear heinous crimes being committed in Chennai. It's become, like I said, fashionable to be so brazen.
I think it's very unfortunate. The fact remains that the chief minister, Stalin himself, is in charge of security, home department and all that, and it's surprising and shocking that there is so much laxity and people can do anything and get away with it, and the remedial measures are not good enough. The fear of law must be there, and if necessary, metal detectors should be installed, there should be CCTV, and events like this should be stopped and dealt with immediately, so that or if necessary, people, whether the fellow is mentally imbalanced or mad or whatever, they need to be punished, so that the fear of law will prevent the occurrence of such incidents in future, Sudha. But it's a very sad commentary on the state of affairs in Tamil Nadu. I am afraid